Good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio, and delighted to be back with you on this remarkably beautiful spring morning after a remarkably beautiful weekend spent outside and having some fun, hanging out with some vaccinated folks and having a great time sitting outside having a dinner last night. Man, it's so much better than it was a year ago if you've been vaccinated. Hawkeye, how are we today?
Delighted to have you back, too.
I'm glad to be back. Did you enjoy your stint in the chair last week?
No. No, I didn't. Again,
you made a Star Trek reference.
I was no Captain Picard or Kirk.
That was the best. You did a great job. You're just Mr. Spock, man. It's awesome. Right. Marker, thank you. For those of you that don't quite know that when I say that, it's because we're marking yet another Star Trek reference here in the program.
No, but I think, we do anticipate some new mask guidance coming out tomorrow.
I think it's going to be
Biden
good
announced,
news.
so we'll see. Should be good news for everybody. Numbers, remarkably are trending down. I think they're trending down in the nation compared to where they were a week or 10 days ago.
So cool. 7-day rolling average down like 16% or something.
Yeah,
really
slight decrease in the Kansas City area for the 7-day rolling average. We can still push that deeper down to 100 or under for new cases a day. But in the hospital, I think we're still doing good. Again, lower back from that number of 20 acute infections. We actually have 11 acute infections today, 5 in the ICU, but 4 of those on the ventilator, so a large proportion on the ventilator. 11 in that acute recovery period as well, so 22 total patients. I think we can live with that. Again, we would always like less than that. And Hayes is doing well as also. 0 active infections and 2 in that recovery period.
Well done, Ellis County and surrounding areas. That's awesome. So, I do think we're seeing better news here, but not so great news out in India.
No, India is being hit real hard. Initially, there were a lot of cases and reports and talks about not only India, but other countries in Asia, there in Africa, really keeping a good control on the number of cases, hospitalizations, and death. But really over the last month or 2, they've seen increased surges. Hospital capacity is a huge problem, not only hospital capacity, but just the ability to get oxygen to those patients that vitally need it.
And it appears that it's the outcome of loosening of restrictions when combined with the arrival of the B117 variant, what was called the British variant, and not enough folks vaccinated. That, and now they've also discovered this other variant with 2 significant mutations. Of course, these variants carry more than these mutations that we hear about, but those are other significant ones. So it is a combination of really all those things. And so at the end of the day, the way out of that crisis, like it would be in other places, is try to put back restrictions, get people vaccinated, and make sure you maintain all those good public health measures. And in Michigan, we know there's been an outbreak that's been pretty severe, also driven in some part by the B117 variant, now beginning to turn back down again. It appears that vaccination, public health measures are beginning to work there as well. Yeah, again, I don't think we can say it more clearly. A vaccination is going to be the way out of this. Again, I think our culture in Kansas City has gotten a lot better over this past year in being able to do the right things, keeping distant, masking, but again, vaccination too. And we know that we still have vaccination spots available, so please call, tell your friends, your loved ones, come to the health system, get vaccinated. Yeah, that is so important. Well, let's just listen and see if there's any reporter questions.
Well, I don't know. Do we have reporters on? I know that Congressman Cleaver is on his way, and they may want to talk to him. He's walking from the garage. But I did have some questions from the community from last week.
Go ahead.
Do you want to try to
answer
we'll take
some
a couple
of those
while we wait for the
Congressman gets here? Yeah, that'd be awesome.
Okay, so Kitty wanted to know, my sister-in-law lives in Virginia and has been receiving radiation and chemotherapy for her cancer. She is currently having lymphatic issues after her first and second vaccinations. Should she be concerned about blood clots?
Oh, that's a great question. We know that there can be some lymphadenopathy regionally, most on the same arm, but either arm, when you've been vaccinated and you're getting chemotherapy and other things. What I would do is talk with your cancer provider especially and ask them that question. Lymphadenopathy is not common in that situation, and it can happen after the vaccine, huh?
Yeah, and if she got both vaccine doses, that's telling me that it's the mRNA vaccine, so we really haven't seen that problem. The blood clotting, even to that extent. Certainly with radiation, that can change your anatomy a little bit, cause adenopathy or lymphedema as well. But I don't think it's a large concern there. So.
Okay, awesome.
All right, and Gretchen wants to know, I've heard you say most likely J&J will have those who got this shot get another. I have a clotting disorder and I'm nervous about getting another. Could I switch to another vaccine this summer, and would I still be okay? So it's like
let me clarify first. So that is my supposition. It's not scientifically proven. There's no data around it yet. So I'm just suspecting that they will have better efficacy on a 2-shot regimen than a 1-shot regimen. So I think as that comes about and we see that, we'll know a little bit more information about that. I think the congressman has arrived, so we're going to bring him on in.
And I think just briefly overall as well, there is probably going to be mixing and matching going on as we get further into this. We get new guidance, new information.
All right. So, Reverend, come on in, have a seat at the table.
Hi.
You don't need to wear your mask. I'm assuming we're all vaccinated.
Yes, I am too.
And we have negative airflow in this room. So it makes it, and we're 6 feet apart.
Yeah.
We got to get your earpiece back on.
Here, I can help.
We'll take care of that for you. While you sit down, I want to just introduce Reverend, Councilman, Mayor, and Congressman Emanuel Cleaver, and welcome to the program today. It's a delight to have you here, sir.
Good to be here.
Thank you very much. You are Kansas City in my mind. I grew up with you in so many different roles here in Kansas City, and I am delighted to welcome you to our program this morning. Thanks for coming in today.
Good to be here. Thank you.
It's awesome, and I know our audience is going to be delighted. We'll have a fun time talking with you. How are things going for you?
Actually, today, well. I'm measured by the day.
Yeah. Aren't we all these days? That's awesome. So how are things in Washington, D.C.? I mean, there's a new administration, the world has changed, and people are getting back. What's the climate like?
The climate is not as healthy as I would want, nor do I think it is where the American people would prefer it. Since January 6th, we have Capitol Hill actually. The campus with the Senate office buildings, the Capitol, the Supreme Court, Library of Congress, House offices, it looks more like a military fort than it does Capitol Hill, the place where democracy can be observed by the public at all times without anybody being restricted. And so now, the cars are not there. You can lay down in the middle of the street and not worry about being hit by a car. But I think things will get back. It would probably never get back to what it was, but things will get back to a point where the American people will be able to walk into their Capitol and sit down and observe a hearing or testify before Congress. And other than that, if you don't go to Capitol Hill, Washington is like it always has been.
Yeah. Well, we hope with you that as other things from this pandemic, the restrictions ease, hopefully the restrictions for freedom of travel on the Capitol also ease. So I noticed, just to say, your cufflinks look like Kansas City Royal cufflinks.
It's difficult for me to hide my
Kansas City
commitment
colors
to and a lot of times, depending on whether or not we're in a winning streak, sometimes we'll have to do this all day.
Yeah, right.
But
right.
And
you're
right
playing
now,
pretty well so far this year.
that's why
This is fun. This is fun.
I love it.
Chiefs are good. The Royals are good.
Yeah.
We get COVID under control. Life's going to be really good. That'll be awesome. Well,
I'm going to help you with this. We're a very casual bunch.
yeah.
And when you
we
talk,
have
if
fun.
you look here too,
Sure.
then the people at home can see your
okay.
face.
All right. So, how do you think COVID-19 has impacted the people you serve, Congressman?
Well, let me do it this way. An old farmer is looking out of the window of his farm, and he sees his prize horse getting out of the gate and running off into the fields. And his neighbors come over and they say, "Well, we're sorry that this is happening to you. Your horse is gone." And he says, "Well, bad luck, good luck, any luck." And then a week later, the horse returns with a herd of wild horses. And so now he only had one horse, now he's got about 40. And so the neighbors come over and they said, "Wow, this is a change." And he said, "Bad luck, good luck, whatever." And so Then his son goes out to try to tame one of the horses, a pinto that he just fell in love with in terms of his eyes, and the horse bucks him. He breaks his leg, and the neighbors come over and say, "Boy, we're sorry, your son's leg is broken, and it's terrible." And he said, "Not bad luck, good luck, whatever." And then the next day, the army comes through, and they're conscripting all of the young people they can to go off to battle. But when they see his son, they said, "Well, he can't go because he has a broken leg." And the neighbors come over and say, "Well, sorry to see what happened, but he's bad luck, good luck, whatever." I think that when we look at something like COVID, there is bad luck, and there's some bad, but there are also some good things in whatever. I mean, we I think have to look holistically at events. One of the things, for example, I think families got a chance to know each other. I mean, we had a return of eating at the dinner table with the entire family, as opposed to everybody, going into the kitchen and getting their own. I grew up at a time when we all sat together every day at dinner. Nobody ate when they wanted to, and so you can look at this as just totally one of the worst things that's ever happened, or whatever. I mean, some good stuff comes out of it, and some bad stuff. I mean, we learned, and I think we'll never go back completely to a period when that people can actually work at home and be productive. We also found out that corporations can save millions and millions of dollars with travel, because we discovered Zoom and WebEx. And I think nothing is, a few things would be totally bad, and a few things are always good. So I think this COVID situation was not one of the more pleasant experiences, but I think that if you look deeply into it, with the stethoscope, you can see some good things.
Yeah, and I think the telehealth has been one of those good things in the pandemic, and that's just been outstanding. And I know there are challenges, though, even in telehealth legislation, whether or not I can work in Kansas and my patient can be in Missouri and I can see them. Do I need a Missouri license? Can we have a national license? Any thoughts about how that's going to turn out and how Congress is going to take that on?
Yes, that's one of the issues I think that we're going to eventually have to address. I'm not one of those who would prefer everything to be national. That all the laws. I mean, right now, insurance is a state issue. The federal government doesn't much get involved. Policing, one of the things that's been discussed a lot, is a local issue. But now there's legislation that would create national standards. So I think that with telehealth, there are probably going to be some national standards, because it makes no sense at all to restrict somebody who lives 15 blocks from KU from getting medical care here, and because at the end of the day, if there's something that comes up, he or she shouldn't have to worry about what address the doctor has, and where he or she went to medical school, and so I do think that's coming up, because that is a big deal and it's being talked about often.
Yeah, I think that is important, and thank you for that. So, as you've been vaccinated, are you recommending to everybody let's all go get vaccinated?
Absolutely. I believe in science. I didn't do well in it, but I still believe in it. I believe in basketball. I didn't do well in it, but I do believe in it, and I think that we've got to get this plague under control, and the only way to do it, from my perspective and interpretation, is to follow the science. And so I believe that we should honor the distance. I saw my niece, who lives here in the metropolitan area. Actually, she's a vice provost over at KU. But I saw her for the first time in a year Saturday, and I couldn't believe I get a chance to hug my niece. She's had her vaccine. I've had mine, and I pay attention to Dr. Fauci and others. The NIH on what they are thinking about mask wearing and whether you can take it off if everybody has been vaccinated and so forth. And I am a person who believes that this is very important. We can kill this thing before it kills us, because if we continue to let this virus run free, even as it is doing so now in other parts of the world, my fear as a non-scientist is that some variants will ultimately become a tough customer that we have to deal with in addition to COVID-19.
So I think you just passed science right there. I think you did. You just got high marks. That was really good. So when you said you didn't do well in science, well, I think you did.
Yeah, Miss Polk didn't think so.
So we've said of this program for a long time now that let's take that combination of faith, hope to get us through the first part of that, and now science, and then the last part of that strand is now belief. That you have to believe. With science has helped has brought us what we've called before on our program the Mahomes effect. Mahomes walked into the game. Again, we're a little pro Kansas City here. Mahomes walks into the game, anything's possible. Moderna and Pfizer and J&J, that is the Mahomes effect. Now you just have to believe and go get it done. So pretty big deal. Let's see if there are questions from reporters on the line.
Sure. Good morning. Cody Holyoke with
Cody,
KBC9.
welcome back.
Hey, two questions. First one's for Congressman Cleaver. With vaccination rates slowing down in many places, even counties turning down vaccine doses, I'm curious your take on combating vaccine hesitancy. It's something we've seen quite a bit as we push forward into this pandemic. We've seen this in rural areas and urban areas still. What are you seeing? What's your take? And is Congress doing anything to try to maybe shore that up?
Well, Congress, we put money into every one of the stimulus packages that we've approved, which is actually two, but we also have a big chunk of money in this the so-called infrastructure bill or the jobs bill. But I think what we've got to do more than anything else is to depoliticize that. We politicize everything. It's one of the things that's not healthy for our country at this moment, and probably no moment is it healthy. But I mean, it would be good if we could get people on, no matter what their political pedigree might be, to work together, coming on television, going out to the public, talking about the need to be vaccinated. We had, unfortunately, one of the U.S. senators who was probably appeared on every network over the weekend saying he didn't understand why everybody needed to get a vaccine. He's a good and decent person. I don't think he's an evil person. I do think that was not helpful, and one of my good friends, Shelley Moore Capito, senator from West Virginia, said as much on the Sunday shows yesterday, even though she's in the same political party. She said, we've got to stop doing that. So this vaccine hesitancy is dangerous. It is dangerous because we are going to leave a substantial amount of a number of in our population unprotected, and my fear is that people hear that bad things happen, and they don't hear enough of the yes, there's something that could happen that can be categorized as bad in just about any and everything. But we're going to have to win this by example. We need every human being, particularly those who are in the public eye, to come out and push for vaccination.
Yeah.
Cody, other question?
Yeah, my question for the doctors. Thank you, Congressman. Well, we're talking about the Johnson & Johnson pause. I know that has sort of been unpaused. Missouri went right back to using it. Kansas, it's expected later this week. I was just curious if you could kind of peel back the curtain for us. What's going on behind the scenes, and what issues do you anticipate?
I think the biggest issue, Hawkeye, is going to be just more vaccine hesitancy based upon that. And it's unfortunate because if you stand back and you look at the real data, J&J is so much safer than just about any drug out there. You had a great example when we were talking before the program today about ads on television where all the different drugs.
Yeah.
At the end, they have like, oh, your stomach may fall out, your brain may rot, all these terrible things happen to you. Yet people want those drugs.
Yeah.
And here we have J&J, 1 in a million, or now maybe 2 in a million cases of clot. That's an incredibly great safety profile. If that was the only vaccine we had available, we'd be like, line up, get this vaccine. It's incredibly safe.
Yeah, I mean, again, we're talking about a therapeutic with a drug that you're taking every day, saying this may cause serious infection, death, diarrhea, cramping, all those things. People want to argue with their insurance companies so they can get that drug to take every day. But for this, although again it's a preventative, but for this 1 or 2 dose shot, you have these low risk of these complications, and we know what to look for and how to treat it. And there's hesitancy around that. So I think that's just not consistent with thinking of science in that point. But,
And a great, please.
Hey, I didn't go to medical school. I did do a commencement for medical school. But look, I played football in high school and a year and a half in college. I had an ACL, and so I've had a total of 7 surgeries on my left knee. 2 of them were replacements. 1 replacement, 1 was a revision. And I've been around long enough to know that you can get blood clots, that there are people who die. In fact, if there are Kansas City Chiefs fans here, you may hear the announcement somebody won the Mac Lee Hill Award. It's usually the Rookie of the Year. And so it was a running back for the Chiefs way back in the probably in the 60s, who had surgery and died with blood clots. And
Derek Thomas.
Yeah. I mean, but I mean, nobody's going to say, well, guess I better not have the surgery. I realize I can't walk, and so I think there's some danger in everything, but we go on. We life itself is taking chances.
And the good news is we understand it now, and there are treatments available for those blood clots that happen 2 in a million times. And so, again, when you look at it, great report this morning, I reviewed from the New England Journal of Medicine. Again, we've referenced that as well. They do that podcast once a week, and it's a free podcast. Anybody can download it. And one of the things they spoke about was this issue of how does the J&J vaccine fit across the world. And it's incredibly important because it is a one-shot vaccination with good effectiveness. And so as a result, when you step back and you look at that and you say, wow, it's a one-shot vaccine. So many places in the world where it is a hard-to-access patient population, this is an incredible step forward. You have to have confidence in the belief and in the science because it really does work.
Yeah, and I think to piggyback on Congressman's first answers to his questions about the vaccine hesitancy, because all of this is related. Individually, we know that the data is overwhelmingly in favor that it is the vaccines, whether it's the mRNA vaccines or the adenovirus Johnson & Johnson vaccine, are going to reduce individually your spectrum of disease, especially preventing you from going to the hospital, severe disease, and death. But moreover, on a community level and having concern for your citizen, your other fellow citizens and your neighbors. On a community level, we have more data signal that now you can also reduce transmission of the spread of the disease as well with vaccination. So all of those points are very important to understand.
And to your point, Congressman, the individual who was on the Sunday morning talk shows doubting it would not have gotten a good grade from Mrs. Polk's science class out there.
That is true.
Other questions out there?
This is Dan from 41 Action News. I had a question for the doctors. There was a report that came out about folks who were skipping their second shot. And you mentioned the high caseload in Michigan and vaccinations are going up. I just wanted your thoughts and your concerns about not necessarily vaccine hesitancy, but vaccine complacency, if you're starting to see that out there.
Yeah, that's a great question, Dan, and thank you for asking that. So people who had a 2-shot regimen or Moderna, Pfizer, I forgot what the percentage was. I saw it this weekend. It was about 5 or 6%, 8%.
Yeah.
Folks were not getting that second vaccine, and people were reaching out trying to get them to do that. The reason to do it is that there's a pretty significant jump between 80 and 95% effectiveness if you want to be the most safe you can be. And so for that reason, I think you want to get that second vaccine. The second reason is that we believe that the antibodies that are raised, that as your immunogenicity, as we say, how well your immune system is primed to respond to COVID-19, lasts a lot longer with 2 shots than 1 shot, Hawkeye. So for both those reasons, pretty important.
Yeah, and I think that was one of the initial points we had talked about when the vaccine schedule was coming out about getting 2 doses, and the people were debating, well, can we only get 1 dose? I don't see a problem with a delay of a dose of 2 to 3 to 4 weeks, maybe, if you can't otherwise get it. But we always said that was a concern, that people will get complacent. They won't get that second dose. And really for that second dose is when you're going to see optimal immunity, and for that duration of time as well.
Yeah, so we hope that those people will make those choices. And, listen, even if you're 3 weeks late or 4 weeks late, go get it, because it still is going to help you. And there's some data even out there that suggests if you wait a little longer, it could be even better. So just go get that second shot. Don't not do it. You've already gotten the first one. Get all the protection you can. Get that second shot. Other questions?
I have 3 from Fox KC that they sent in late last night.
Go for it.
One of them's for the congressman, and the other are a couple of doctor questions that you can feel free
I think
to weigh in.
Congressman's ready to answer those. From what I'm hearing this morning, he is well
The first
versed.
question is, KSN yesterday reported that nurses from Via Christi had left for a hospital in Michigan to help there, and they wanted to know if we were sending any nurses. So you might explain how that works. Do we know if any are volunteering?
Yeah, so I don't know the full story about the Via Christi system. That is that's an Ascension Health, and oftentimes what you see in these national health systems is they may leave, like HCA had nurses go from one area to another area, and I don't know if that's what's going on here or not. I don't know of any nurses that we're sending, but I may not know of it, and it could be happening. So we'll research that and find out.
Okay, second question is, it sounds like counties and cities are moving toward relaxing mask mandates and easing other safety requirements. Is that a mistake right now? And she's interested in the congressman's opinion on this as well.
Well, I try to get too involved in local issues with the state and the county and the city. Let me just say that I think there is always a danger in underestimating the potency of a virus running wild, and I think we ought to be extremely careful about relaxing, the mask wearing and large gatherings. I'm still afraid of super spreader events. Look, I love football. My family would say I'm almost worshipful, but I think that if the medical world says, we shouldn't put 75,000 people into the stadium, that's not a healthy situation, I would advise people to pay strong attention to it. That's why they invented television. It was invented for football. So, you can still watch it.
I love that answer. And the last,
and just remember the New York Giants playoff game back in 1958 was an overtime game, and Johnny Unitas took the winning drive, and that was really, many have cited that game as being the start of the broadcast of football. No, that was, and it was against the Colts. The Colts won on that. So
Baltimore Colts.
But back then it was okay. We are dating ourselves right now.
Okay, and the final question from Fox KC. CDC announced that kids at camp can distance at 3-foot intervals instead of 6. Is this a good idea since they won't have been vaccinated?
What are you thinking?
I think also, and I didn't get to read all of them, but I think also there are also guidance that masks should be worn as well. So, masking is going to be important. The distancing, we've seen various data and publications about distancing, and we know that
World Health Organization has been 3 feet all
along. 3 feet forever, because for one reason or another. So the same thing. So I think these are all steps that people are trying to take to get back to normalcy. Are they necessarily correct or right? It's really difficult to judge, but we know not one thing is the panacea. So there are multiple things. Masking is one of them. Distancing is one of them. Doing as much as you can. Also, I think a lot of the camps are going to be doing things outdoors, and we've always said that outdoors is much safer than indoors as well.
So I think it's probably okay, but I'm with you as long as they've got the masks on. And we hope this summer that we're going to see some news coming out from Pfizer and Moderna that's going to say, let's start vaccinating our children, and we really want to see that happen. I think that's a big step forward in our battle against this pandemic. And to your earlier point, is this too early? And my answer is, would you keep Patrick Mahomes safe? Now, I'm not trying to sound like too much of a Patrick Mahomes sycophant, but he is the smartest, best quarterback in the football and on the planet, and there's no bias there. But I think the point is you want to keep each other safe, right? You want to keep each other safe, and how do you go about doing that? We had dinner last night with a group of friends. We didn't have masks on. Everybody there had been vaccinated. We were outside. Felt really safe. First time since the pandemic started that we took that step. That was a really big deal, and it felt great. But you know what the key factor was? All of us had been safely vaccinated. All of us came over and were healthy. Now, my daughter was sick yesterday. We were having Monday morning brunch, and we had our family over. We've all been vaccinated, but she has a cold. So she wore a mask. We wore masks because, we're trying to keep each other safe. That's the answer. And we come back to the last part of that phrase. We keep each other safe. How do you do that? Do you do that by disregarding the science, or you do that by listening to reasonable people like Fauci, like the head of the CDC now, good, reasonable people trying to do the right thing without another vested interest? What are they trying to do? They're trying to keep you safe.
We have had some feedback. In fact, we talked about it over the weekend via email from a viewer who said, you keep using flu data on masking, and they want to hear COVID data. And you said you're using a lot of COVID data masking.
We use COVID data all the time. First of all, Hawkeye and I will take this on together. First of all, let's just turn to the outcomes in our own hospital. We have said this so many times, but listen to this, folks. At one point, we had 250 patients, either acutely ill or recovering from COVID in this hospital. 250. We routinely have 700 or 800 patients. There 250 beds taken up by patients with COVID-19. How many times did we spread COVID-19 to our staff? And the answer is, we didn't. Why is that? Because masking works. All the mask doubters out there, I don't know what proof you will require to accept it, but the data, Hawkeye, the data is overwhelming, and that's a COVID story. It's not an influenza story.
Yeah, I mean, I think it was easy to say you don't have COVID-19 data 9 or 10 months ago, but since that time we have overwhelmingly many publications showing the favorable effect on masks individually and in the community, statewide, nationwide, of using mask and distancing. And so I think that's an argument that just doesn't really hold any water anymore at this point.
And Congressman, I'm going to bet you support mask wearing for your family and your community here and in D.C.
Oh, absolutely. My staff members, I have an office in Kansas City, I have an office in Higginsville, Missouri, I have an office in Independence, and my office in Washington. When we are in the office, we all wear a mask. I take it with me. I had a meeting with the president last Tuesday. You have to take a test before you, 3 hours before you go to meet with the president. And then when you get to the White House, this wasn't even enough. I hope I brought it with me. I carried it around because sometimes I double mask. But they required another kind of a mask. And
you keep pulling stuff out of your hat here. I mean, this is impressive.
But to go inside the White House to meet with the president, they made me take this off. You have to wear this. But I'm not mad. What I did is stole.
I acquired
some extras as I was leaving the White House.
Right.
So I wear the mask, and I'm not upset. And back with flu, this is probably not scientific. This is the first year I can remember that I didn't have a cold.
Right.
And I attribute it to this.
Yeah.
And you're right, and all the public health measures. In fact, Hawkeye, I don't think we've admitted a patient with influenza this year.
No.
And you say, well, that's not proof of COVID-19. Okay, actually, it is, because that's the proof of the concept of how respiratory particles and viruses transmit. Because we also haven't seen RSV, we haven't seen influenza.
Right.
Our number of other coronavirus cases, our number of all of these things is remarkably lower.
Reduced, yep, exactly, from taking all these measures. And again, it's not just one, it's a combination of all these things.
And remember, coronavirus is still a coronavirus, and it's going to spread like coronavirus. And coronavirus is a respiratory particle, and because of that, it spreads by way of your breath, and when you wear a mask, it gets trapped inside the mask. So the science is real, people. Science is real.
Okay, so I know we have like 4 minutes because you have a hard stop, which is great. Cindy wants to know, what is the mask culture in Washington, D.C.? Is there a mandate there, or do people, although we've had our doctors say you don't have to have a mandate to wear a mask. I'm just curious. She's curious.
We have a mandate, and it's a serious mandate. You cannot go into a committee hearing, and you cannot go into the chamber without a mask. If you do, you will be escorted out by Capitol Hill Police. It's very, very serious. Now we've had some people to play with it. Somebody came in with a gas mask on and so forth, which was trying to make fun of the fact that we're wearing masks. But it's on Capitol Hill. It is serious. You wear a mask or you don't get into anything. Or you'll be asked to leave, and if you walk in without it. And when we came back after January, there were a few people who didn't and still do not believe in masks, because they chose not to wear it, or they would do this. And so finally, the speaker said, if you don't cover your nose, you can't come in. So it's a serious deal. Even people who don't believe in it have to function with it.
All right, and Jean wants to know, doctors, are you familiar with an MIT study on social distancing indoors, where it said you're no safer at 60 feet than you are at 6? Are you familiar with it, or should we look it up?
Well, let's take a look at it. I think I know which study they're referencing. I'm not sure that's the right conclusion from it, but we'll verify that and be back with you tomorrow.
Okay, we'll
bring that up with Dr. Lee Norman, too.
Yeah, we'll do that tomorrow.
And Catherine Satterwhite.
We can do that tomorrow with her, too. And the last question is from Diane. There has been a talk of a booster vaccine. Any thoughts on timing, and what would it cover?
Yeah, so the booster vaccine for COVID will cover COVID. I don't think it's going to be combined with other things yet. I'm going to guess that's late fall, early winter, Hawkeye.
Yeah. I was just going to say late fall, early winter. I think that's what I've heard.
Will it include the variants? That might be what she's asking.
That's what they're
pivoting to. I think for Pfizer and Moderna, they're already working on pivoting and putting those into their vaccine. So I would expect that those things are going to come out relatively soon. The FDA has already said they don't have to go back and do a bunch of more field testing with it, which is similar to how they would have treated the influenza vaccine. So I think we'll see it coming out, and I bet it comes out. But I think that will probably come out before fall and winter. But remember that thus far, Moderna and Pfizer have excellent antibody responses and immunogenicity to all the variants that are out there.
Yeah.
Right.
Yeah.
All right.
Time to wrap it up.
Let's do it. Congressman, final thoughts, sir.
Well, I'm glad that you're doing this program. I wish we could pipe it into Washington, into the hearing rooms with members of Congress. I think
we're available anytime.
It would be helpful for everyone to hear what I've heard today, and I appreciate very much the work you're doing, and hopefully, in another year, this will be something we'll talk about as something in our deep, dark past. But right now, we've got to win this war, and I appreciate you guys on the front lines doing it.
Well, we appreciate your help, Congressman. Let me just say, I grew up in Kansas City with first, again, as a reverend, then a council member, and then a mayor, and now as a congressman, and it is a real honor to have you on our program this morning. So thanks for your great service to Kansas City. Thanks for all you do, and thanks for your support of the Royals, Chiefs. K-State, KU, and of course MIZZOU.
Yes.
And by the way, if you ever want to go hear the Word of God, just listen to Reverend Cleaver when he's preaching. He tells those stories. He's the best storyteller in the world. All right, Hawkeye, final thoughts today.
Yeah, again, we've had some questions going back to what is the science, what is the data. There is overwhelming data about three main things that help stop the spread of the disease. The first is vaccination. Individually, it protects you against a severity of disease. Again, there are also signals that it also protects against the transmission of disease, so you're helping your fellow citizens. The next thing is masking. Overwhelming evidence about masking protecting. It serves as a barrier so you are not expressing the virus out into the environment, and it serves for protection for you as well. And then the third thing is distancing. Keeping that distance as much as possible. Certainly outdoors is better than indoors. Those three things. And it's not just one thing, it's a combination of all those. And then, lastly, as a fourth part, more as a general good health measure for you to take every day is hand hygiene, of course. And sticking to those three things, and then, of course, routine, adequate hand hygiene, is going to keep you, your loved ones, and your community as safe as possible until we can fully get through this. But those are the three measures that will help us get through.
The rules of infection control travel with you wherever you go. Hey, tomorrow, KDHE Secretary Dr. Lee Norman is back on our program. He's going to be talking about vaccination and infection rates. He's going to be joined by Dr. Catherine Satterwhite, Regional Health Administrator for the United States Department of Health and Human Services. Dr. Satterwhite is going to share messaging that might prove helpful to folks from different walks of life who may have a little hesitancy. Maybe they're on the fence about the safety of the vaccine. Friday, the Kansas Department of Health and Environment opened wide the door for vaccinations. The shots are available to everyone, age 16 and older. It doesn't matter where you live from any state. You can do this. Kansas joined more than 20 other states because we know that COVID does not stop at the border, nor does it discriminate. COVID will come for you no matter who you are, where you are, what you are, how much you make. It doesn't matter. COVID doesn't care. It only wants one thing, and it wants you. Remember that faith, hope, and science have carried us through this pandemic. You can go to health system for our patients, go to MyChart, make an appointment to help deliver us on the other side of that. Or our non-health system patients can go to kansashealthsystem.com/vaccine, or anyone can call and I mean anyone, because it doesn't matter where you're from now, 913-588-1227. You can sign up for a vaccination here at the University of Kansas Health System. Faith, hope, science. We've talked about that for over a year. For all of us, it has to mean faith in each other. For me, it means faith in God. Those things help sustain us through a pandemic, along with hope, that we know that if we work together, we can get to the other side of this. And then the science and the belief in the science. And it takes all of us. Remember, it says, we the people, not I the one. We the people. We do it together, as we have for almost 400 years. We can do this again and again and again, and we can win this pandemic. But we need you. We need your arm. We need you to get signed up. We're here tomorrow. We'll see you then.